All right, couple points. We have our first test next week. I am going to do 2 reviews for you guys. One is an in-person class review, like all my classes. You guys lead. You have questions, I have answers, clarification. In addition, I'm going to email and post a video that actually may already be on Moodle, but it was a Q&A I did with last semester's class about content. It's clarifying things, what's important, what do you need to know. And so I'll give you that one as extra clarification. But y'all, this is, to me, this is the when class really starts, going over specific muscles. That's the fun part, okay? Again, we know the bicep, the tricep, but what about all these other muscles that don't ever get talked about that you guys are going to need to know? Remember, from my class, function, function means how does it pull? What directions of motion do these muscles pull? And if you think about it, that means it pulls in these certain directions regardless of contraction. Isometric, it pulls a certain way. Eccentric pulls the same way. Concentric pulls the same. Muscles only pull. An elevator pulls up regardless of how the elevator is moving. True? That's all we're doing. We're just taking that concept of how do the muscles pull? And then we apply that to, here's the agonist, here's the motion, here's the contraction. If the muscle pulls forward, I need to stretch by moving the neck back. Like we'll get into some of the application stuff, but function is pull. Pull. How do the muscles pull? So this is what's great about you memorizers out there, which we all need to memorize to some extent. These are the functions of the 4 muscles I'm giving you for the circle. I'm telling you, how do they pull? The right sternocleidomastoid is a cervical flexion puller, a right lateral cervical bender, and a left transverse cervical rotator. I'm going to show you how it does that, but I'm literally giving you what's the importance of these muscles. The left sternocleidomastoid is a flexion puller because it crosses in the front. It's a front pulling muscle, a left lateral puller, and a right transverse rotator. I'm going to show you the muscle, and I'm going to show you how it does these things. But these are literally the information that's important. Left erector spinae, extension puller, left lateral, left transverse, right erector, extension puller, right lateral, right transverse. How do they pull is what's of importance. Now, how do these muscles fit in our circle? And then I'll go through the muscles specifically. Well, here's a cross section of our cervical vertebra. Remember, I have to rotate it for everybody to see. So in real life, the circle would literally be around your neck. But in order to view it, I have to rotate it. So it's literally like we're looking at KNES cervical vertebra. Anterior to the bilateral axis are going to be my flexors, right? Chin to chest. Posterior crossing muscles are going to be my extensors. Back of the head, the spine. There's my AP axis, the right muscles. The muscles on the right side of the AP are going to be trying to pull your right ear to your right shoulder. And the left ones are going to be trying to pull your left ear, left shoulder. And then recess, the polar axis, this is our merry-go-round. We're going to have left transverse and right transverse pulls. Those 4 muscles, this is how they sit in class. Your right sternocleidomastoid sits antero and on the right side. Now, notice I didn't say like anterolateral, medial. Medial and lateral are sides of sides. When you only got one of something, you could literally have a right ear and a left ear. So this is literally sitting on the front and the right side of class. Front left, back right. My cervical flexors, the ones that are pulling chin to chest, are going to be my anterior crossing muscles. My right and my left sternocleidomastoids. My cervical extensors are going to be my left and my right erector spinae. My right lateral cervical benders, right ear, right shoulder, are going to be the ones that cross on the right side. Luckily for us, right erector spinae, right sternocleidomastoid. The left laterals, left ear, left shoulder, left erector, left sternocleidomastoid. And then here's the fun one. PE, playing with the merry-go-round. the merry-go-round the exact same way as my front right. And that makes a lot of sense. If you were trying to spin a basketball, you'd want a hand on the front right and a hand on the back left to spin. And that's the sound that it makes when I spin a basketball. So it goes fly out. Does this make sense? From the polar axis, these two muscles are trying to spin the same, and these two muscles are trying to spin the same. So if you're a visual learner, this is great. I give you scratch paper test starts. You draw a circle, bilateral, AP polar, right sternocleido, left sterno, left erector, right erector. These two are trying to spin the merry-go-round that way. These two are trying to spin the merry-go-round that. In 30 seconds, you're like ready to answer any question that he asks. What's the function of the left sternocleidomastoid? It's a cervical flexor, left lateral puller, and a right transverse puller. Now again, we're going to go through the muscles, but I'm just showing you how a visualization of how muscles pull based off of a cross-section of how they cross the joint can be a very useful tool. I will never ask you to draw this for a test. This is a teaching tool. This is a coaching tool to help you guys see how these muscles pull in different directions. Checking for understanding. The right erector spinae has 3 functions. It's an extension puller because it crosses the back. It's a right lateral puller because it's on the right side. And it's a right transverse puller because it's spinning the merry-go-round. Left sternocleidomastoid is a flexion puller, a left lateral, and a right transverse. Now let's get into the muscles. All right, guys, you have 2 sternocleidomastoids. Some muscles get their names from their origin insertion. I mentioned that before. Some have Latin names, and some have a combination of Latin and direction of pull. Those are my favorites. You have a muscle in the arm called the brachialis. What the heck does that do? But you also have a muscle, good, called the supinator. I know what that does. It's a supination puller. So the muscles that have pull in their name, those are the best ones. All right, let's talk about the sternocleidomastoids. If you say sternocleidomastoid, sternum, right, clavicle, cleido, and the mastoid process, do I have a spell? There's your mastoid process. It's literally right by your ear, right by your external auditory meatus. So it's that bump in the back of your ear. So when I say ear, it's just because it's around there. It's not literally pulling on your ear. It's a muscle. You have 2 of them. You have one on the right side, you have one on the left side. The picture on the left shows you, look how steep that muscle is. But remember, trigonometry says, even though it's steep, there's still an X and a Y component to its pull. Does that make sense? So that muscle pulling on the mastoid process still has an anterior pull to it, even though it may not look like it, because it's angled. So does that just make sense? If I had a string and I pulled forward, wouldn't that be pulling in a direction of cervical flexion? Yeah. So your cervical flexors, your main cervical flexors, are your right and left sternocleidomastoids. This is also your first example of how agonistic muscles, remember we talked about agonists, muscles that are recruited to do a job. They can cancel out in other planes. So we know that the sternocleidomastoids are pulling forward or sagittal, right? But the right is also trying to pull laterally. But the left is also trying to pull laterally. So they can cancel out when they're working together and just work together to pull forward. Think of it like this. If we were moving a table and I was pushing on the right side, and you were pushing on the left side. If we pushed together, the table would slide forward, right? But if you stopped, wouldn't the table all of a sudden start rotating? That's what I'm talking about. Together, they pull anteriorly, or they pull in a direction of flexion. They're flexion pulled. But if one would stop, this one would go here, or that one would go there. So they can cancel out frontally to pull sagittal. They also cancel out transversely, but I'm not going to get there yet. So these two views, this is a three-dimensional muscle. These two views are great at showing the sagittal pull, right? The forward pull, flexion pull. This one's great at showing the frontal pull. For the frontal, the right is a right lateral puller, and the left is a left lateral puller. Make sense? So look at what that would look like on your circle. There's your right sternocleidomastoid. This is the line of pull. Left line of pull. Working together, they pull in a direction of cervical flexion. In the frontal plane, though, my right pulls right lateral, and my left pulls left lateral. And when they work together, they can cancel out frontally and work sagittal. So far, so good. So can we see cervical flexors, left and right sternocleidomastoid, because they're pulling anteriorly? But the right and the left have different pulls frontally. That's okay. Now we're going to get to the fun stuff. Transversely. Transverse pull. All right. Yes. The best view in terms of a transverse pull is here. That's what obliquely means. It just obliques, it's just angles. Just a fancy word for angles. That's at an angle. That may not be a big angle. What we learned from trig, it doesn't have to be big to be significant. In addition, I want you to look at this and this. That muscle is trying to bring the mastoid process, which is by your ear, transversely, it's trying to bring it across to line up with the sternum. Does that make sense? Try a better way. If I attached this rope to my ear and I pull just the right ear forward, wouldn't it be pulling to try to make me look to my left? I think last class I said if my mom grabs my ear and yanks it forward, it's trying to make me look to the left. So something on my right side can pull in a direction of left transverse. That's like saying somebody on the right side of a merry-go-round could try to make it spin to the left. Absolutely. So the right sternocleidomastoid is a left transverse cervical rotation puller. I'm going to show you other tricks to see this, because this is where students struggle the most. This one. Because you think everything has to line up. That makes sense. Something on the right is pulling to the left. That makes no sense. Well, not in linear sense, but in rotational sense, it does. Guys, what do we know about muscles? They can only pull. If I shorten a muscle, it's going to be put on slack, and if I lengthen it, it's going to be stretched. You know, when you stretch your hamstrings, you don't extend your hip, you flex your hip. Right? So watch this. If my sternocleidomastoid on my right side is you know, in resting tone in anatomy, if I look to the left, what happens to that rope, to that string? Because it got short. Because that's how it's pulling. Watch what happens when I look to the right. It gets longer because it was being stretched. To me, the best way to see this is to take your pointer, your middle, and your thumb and literally recreate the sternocleidomastoid's origin and insertion. Sternum and clavicle. Mastoid process is right by your ear. Muscles only pull. So when you contract or pull the two points of your fingers together in the transverse plane, your right is trying to make you look to your left. And when you pull the left, it's trying to make you look to your right. You can feel your fingers kind of pushing you. Another way is, trying as a bad child example. You know that muscle is pulling by your ear, and you know the right side has an anterior draw to it. It has an anterior pull. So if all you did was pull on the right side forward, it would be pulling in a left transverse direction. Left is trying to spin you to the right. Right is trying to spin you to the left. Does that make sense? So now we can put all the pieces together for our sternocleidomastoids. Both of them together only pull sagittally because they're canceling out frontally and they're canceling out transversely. The right is a right lateral puller and a left transverse puller. The left is a left lateral puller and a right transverse puller. Does that make sense? And all of that is because of how it's pulling. You wouldn't have unlocked the secrets of the transverse and the lateral by just knowing its origin and insertion. Does that make sense? Origin insertion can be very important if you're palpating areas. Well, what muscle originates there? Massage therapists need to know origin insertion, but in terms of function, how do muscles pull? It's all about how they cross. So on the test, if I said, give me 3 functions of the right sternocleidomastoid, cervical flexor, right lateral cervical bender, left transverse cervical rotator. You could either memorize it, I don't care, or you could literally just see, well, how does that muscle cross the cervical? Crosses in the front, it crosses on the right side, and when we go outside for recess, it's trying to spin the neck around this way. It's how it pulls, right? A lot of times, guys, students, when we get to the stretching component, well, I'll get to the stretching component on Friday. But let's look at our PowerPoint. If you guys want to pull up your PowerPoints. Right sternocleidomastoid. So for you visual learners, well, did I get that on recording? Sorry, I love you guys. So I need to get Mr. Shane to log in. So for those of you that can pull it up, it should have a little play button. Some of you have the play button on the PowerPoints. So if you hit that play button, you'll literally see it pulling to the right side. you'll see it pulling to the left side transverse. See if I can get Mr. Sheen to. If I don't need Mr. Sheen, I might be able to finally do something techy by myself. Recognizing. It's probably I can never troubleshoot. I can create trouble, but I can never shoot it. This is why I trust it. Let's try again. Never know. Never know, you guys. Never know. Time for everything. Here we go. Right lateral. Remember, it's all about pull. Function is about pull. I'm not saying it's an agonist. I'm not saying it's pull. Can you see how it's pulling laterally? Right side, right lateral. Now, watch the transverse. Can you see how the right is trying to pull you to the left transversely? Not frontally, but transversely. In other words, if I was to magically remove, or let's say my friend is a nurse anesthetist. I numbed all my muscles and I just pulled on my right sternocleidomastoid. This is what would happen. It would go forward to the side and then here. But when I use this one's trying to do the exact opposite, so they can work together to just pull this way because they're canceling out here and they're canceling. So I'd say the biggest struggles on the first test is remembering right and left mean two different things. This was a 310 concept. Right and left mean cartwheel to your right, cartwheel to your left, or spin to your right, spin to your left. So just study so that you don't confuse right lateral from right transverse, left lateral from left transverse. Good? There's the left. Just the exact mirror opposite, frontally and transversely. And then working together synergistically in sagittal, canceling out frontal, canceling out transverse. Good? Okay. Now, before we go on to the erector spinae question, let's talk about muscles. Remember in 310, I taught you concepts of stretch where muscles can only pull. So if those muscles, if we have, let's say, hip flexion pullers, we call them the hip flexors. The only way to lengthen hip flexion pullers is to extend the hip. You extend the hip, oh, you feel that stretch from my flexion pull. You flex the hip, you feel the stretch in your extension pull. Same exact concept, except we're going into specific muscles. So in other words, how would you stretch cervical flexors? By extending the cervical vertebra. That's how you're going to lengthen flexion pullers. How would you stretch extension pullers? Flex the cervical. This is the superpower that you guys are going to have, hopefully, leaving this class. Because in the real world, it's not groups. There's going to be times where you're going to have specific contractures, specific issues with specific muscles. And we need to know the functions of those muscles so that we know how to position to stretch. So let's say you're working with someone in therapy and they have a specific tightness of the right sternocleidomastoid. To stretch it, you got to know how it pulls. So now you're like, oh, the right sternocleidomastoid. It's a flexion puller. We need to make sure we do some extension stuff. It's a right lateral, so we need to make sure we bend to the left. And then here's the hard one. It's a left transverse, so we need to make sure we look to the right. Now, eventually, after you start playing enough, you can do some combinational stuff, right? You can do back, look to the left, right? But for this test, it's about understanding if you know how it pulls, it can unlock a lot of functional things you can do with it. Where students, to me, get confused, it's falling for this trap. Watch this. Let's see if I can get a real life image. Yes. Yes. We're gonna go here, we're gonna go here, we're gonna go here. Watch this, you guys. Okay. Do you see? Joink. 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 Yo, I'm Elon Musk, bro. Where this computer today? Sorry, I was the only famous person who could pick up a smart. This is a good way to 8 words computers do. Here's what messes with us. If I'm looking to my left, you see that right sternocleidomastoid muscle just staring you right in the face. That muscle is not being stretched. But it's staring you right in the face, but it's not being stretched. This one is being stretched because the mastoid process, right, your ear is getting further away from your sternum when you look to your left. What a great question. And the answer is because of Friday's lecture. You feel the erector spinae coming from the back to the front, and you feel that stretch here, but it's really muscles that are in the back. Because when you look to your left, you're bringing back stuff towards the front. And that's what you're doing. Does everybody understand? If a muscle pulls to the left transversely, you can't stretch it by looking to the left transversely. It may seem weird, but it's no different than how do I stretch a hip flexor? Extend. How do I stretch a hip extensor? Flex. How do I stretch an adductor? I have to abduct. Why would it be any different here? If I'm trying to stretch a left transverse rotator, I need to rotate to the right. You feel the erector, same side erector. I'd say this is one of the biggest challenges. All right. Flexors or extensors? We did this last class. Good. We haven't gone over who they are yet. Flexors or extensors? Flexors, who are they? So in other words, your circles or your lists don't tell you if something's working or not. That's why we spent 3 months at 310 trying to figure that out. What your circles or your lists help you to do is identify who are in that group that you identify. So for this one, you're like, oh, those are my cervical flexors. Who are those muscles? Well, those are my anterior crossing muscles of the neck. My right and my left sternocleidomastoids. Make sense? Which sternocleidomastoid would be an agonist here? Would my right or my left sternocleidomastoid? trying to do this. He needs muscles that are pulling this way. Who pulls that way? Left. Your circles don't tell you if something's working or not. Notice nowhere in your circles or your list does it say isometric, eccentric, concentric. 310 helps you to identify the agonists, and your circles in your list help you to remember who's on those teams. I need left-sided pullers. Who's on the left? I need right-sided pullers. Who's on the right? I need anterior pullers. Who's in the front? I need posterior pullers. Who's in the back? Does that make sense? All right, guys, let's go to the erectors. Life's about to get really easy. I think I mentioned this last class, guys. You got 100 of these things. Grad school, have fun. But the one consistent is they do not cross the border. That is the spinous process. That's why we can do what we're doing for this class. In other words, your spinous process is like the Great Wall of China, keeping the right side off of the left side. So you have right-sided erector set and you have a left-sided erector set. And the reason you have so many of those muscles, guys, is they have to be fatigue resistant in order to keep you upright all day. You got to have a lot of help so you don't get fatigued. And also you need a lot of protection back there too, right? Make sure those vertebrae stay in line, all that other good stuff. But here's what I want to show you. Notice if we zoom in, let's see if I can figure out, man, if I can figure out all that other stuff. Look at me. If we zoom in, spinous process, you see how the right side is very similar to the sternum, trying to pull right ear to right shoulder, laterally, frontwards. You see that? So the right erector has the exact same frontal plane function as the right sternocleidomastoid. Right ear, right shoulder. Now, obviously, they have different sagittal plane pulls, right? Because the erector is in the back, so it's trying to pull the base of the skull to the spine, right? So it's an extension pull. But frontally, it has the exact same pull as the sternocleidomastoids. And the left is going to have the same pull as the left sternocleidomastoid in the frontal line. Does that make sense? So the extension pull should be pretty easy. What's in the back? It'd be an extension. Right side of the spinous process, right lateral. Left side, left lateral. Now, notice the obliquity. Notice the angle. For the erector, it's a little different. It's the same, but it's a little different. If my mom pulls my right ear forward, she wants to make me look to the left. But if my mom's behind me and she pulls my right ear back, she's actually trying to make me look to the right. We'll try that another way. Right ear forward, it's pulling me to the left transversely. Right ear back, trying to make me look to the right transversely. Watch. Right erector. Trying to twist his head to the right. Taking the right and pulling it back. It's right transverse pull. Taking the left posterior and pulling it back is a left transverse pull. Check it out. Left erector. Left lateral. Left erector. also see when we're playing recess, left, pulling my left ear back, working with my right, pulling my right ear forward. That's where you get that optimal twist. Left, pulling this way, with right, pulling this way, spinning that basketball. Again, I think the biggest hurdle is know the difference between frontal and transverse. Left lateral and right lateral are frontal plane pulls. Right and left transverse are transverse plane pulls. Right side, and then here's both of them working together. Again, what's cool, canceling out frontally, canceling out transversely. All right, let's do some practical questions. Look in your notes. This is just practice. On the test, if I say, what is the function, how it pulls, of the left erector spinae in the frontal and transverse? So in other words, frontal pull and transverse pull. If I just give you two, because I could give you three, but you know what, that's going to leave like 15 different choices. So to me, it makes it easier if I just pick two out of the three, so that you have like 4 choices. But if I say left erector, frontal and transverse, you could do it a couple of ways. One is if you memorize all the functions, that's awesome. But it's going to take you a long time to kind of find it in 6 different groups. If you're a visual learner and you do the cross section, you're like, oh, left erector, where does it sit? Oh, it's posterior left. Frontally, it's going to be a left lateral puller. Transversely, it's going to be a left transverse puller. Done, done. How would I stretch the left erector frontally? Well, frontally, it pulls left ear, left shoulder. So I need to bring my right ear to my right shoulder. If I wanted to stretch it frontally and sagittally, well, how does it pull? Sagittally, it pulls in a direction of extension, so I need to make sure I flex. Frontally, it's trying to bring left ear, left shoulder, so I need to make sure I bend right ear, right shoulder. Do you see how useful this can be based off of just understanding how do they pull? Give this one some thought. Talk to your neighbors, or do what I do. Talk to all the voices in my head. If I'm not even going to tell you, I'm going to show you. I want you to tell me which 2 muscles that I'm holding you accountable for are being stretched on the picture on the right. This picture. Transverse, which 2 muscles that you're accountable for are being stretched here? Give that some thought. Don't answer it right away. Without giving you an answer, this is how I would do it. 310. What's my position? How is she looking? Is she looking to her left? Is she looking to her right? Is she twisted to her left, or is she twisted to the right? And then once you know that position, then logic sets in and you say, well, if she's looking to the right, she can't be stretching muscles that pull to the right. Just like if my hip is flexed, I can't be stretching muscles that are trying to flex me. So identify the position and then say, I have to be stretching muscles that are trying to pull back the other way. Does that make sense? Again, if I'm flexing my hips, I can't be stretching hip flexors. If I'm extending my hips, I can't be stretching hip extensors. So if I'm looking to the right or to the left, I can't be stretching muscles that are in the same direction. So how is she twisted here? Is she looking to her right or looking to her left? To her right. She's right transverse cervically rotated. True? So she has to be stretching muscles that pull to the left. Does that make any sense? She can't be stretching muscles that also pull to the right. Those are getting slack. Those are getting shortened. She has to be stretching muscles that are trying to pull her back this way. We identify that as a group. If she's twisted to the right, she's stretching left transverse cervical rotators. And then your circles in your list say, who are those muscles? Who are the left transverse? Oh, I remember that. Left transverse is right sternocleidomastoid, left erector spinae. And like I said, what gets students here, and it's not your fault, is that you see this and you also feel a stretch here, but that's your erector spinae on the left side also being stretched. Your left erector is being stretched just like your right sternocleidomastoid is being stretched. So what you feel in the front is actually something posterior that's being rotated into the anterior.
Did you ask her which one they're being stretched?
Yes. Which one's being stretched? That's okay. Which one? What did you? Sorry, I clarify that.
I said about stand up and put it in the
Yeah. That's okay.
but that was
Yeah, that's good. You know what's great is it doesn't count against you. It's making sure we're on the same page. When I'm asking you a stretching question, it's what's being lengthened. And we know what's being lengthened based off of position, right? So let's do an easier, and maybe I shouldn't have started there. That's my fault. If I gave you this position, which two muscles that I'm holding you accountable for are being stretched here? Don't answer it right away. However, process. Campbell's trying to teach you a process. This could be overwhelming. So you say, well, what do I know? I know joint position. We did that a lot. How am I positioned? Am I positioned right laterally or left laterally? Remember, it's from my perspective. Right ear, right shoulder, right? So if I'm positioned right laterally, I have no choice but to be stretching the muscles on the left side. Do it. You'll feel it. Go right ear, right shoulder. Don't you feel the stretch on the stuff happening on the left? So then you say, okay, well, who is that group? Those are my left lateral cervical benders that I'm stretching because I'm bent to my right. And then the final step is, who are those pullers? I've identified I needed left laterals. Who are the left laterals? Those are the ones that sit on the left side of class. Left sterno, left erector. All right, how about some agonist practice? I want to take advantage of all the time we have, guys, because it's that important. Okay, 3A. 3A, the cable's pulling back, trying to extend me. I need flexors. Your circles say who are the flexors? Yeah, the sternocleidomastoids. Now, here is where 310 also comes in. You've identified it, I need flexors for this exercise. You observe flexion from 3A to 3B. The only way the flexors do flexion is through concentric contraction. B to A, same muscles, right? Because you have the same external force. You're not going to have different muscles. Cervical flexors, the right and left sternocleidomastoids in this case, but you observe extension. How can the flexors do extension? Eccentric contraction. You're going to have to play that game too. The only difference is that in 310, we just did it with the groups. Now what I'm doing is giving you the all-star players on those teams. That's the only difference. And I'm showing you why they're on those teams based off of how they pull. Okay, how about this one? Cable's trying to pull right ear, right shoulder. True. So what group? Don't go to specific muscles yet. Process, steps. Wouldn't I need left lateral pullers? If the cable's trying to yank my right ear to my right shoulder, I don't need muscles that pull in the same direction. Hurt my neck. I need left laterals. Who are the left laterals? Left sternocleidomastoid, left orectospinae. So far, so good. Well, if I'm working my left laterals and I observe right lateral bending, has to be eccentrics. And if I'm working my left laterals and I observe left lateral bending, has to be concentrics. Guys, the reason this is important is because eventually when you start working in your own kitchens, there's going to be instances that you're going to have to just do isometrics, just do concentrics, just do eccentrics in certain phases of rehabilitation. You need to be able to recreate these scenarios where if, guys can think about it, we do this all the time with manual muscle tests. How do I test? That's what all of this is. It's just a manual muscle test. That's all it is. How do I test my extensors? I need to try to flex so that they resist it. How do I test the flexors? I need something trying to extend so that they can resist it. How do I test the right laterals? I need something that's trying to bend me to the left. How do I test the left laterals? I need something that's trying to bend me to the right. So this stuff can be memorized, as it should be memorized. But you're still going to have to play with the tools that I taught you in 310. External force is trying to do what? Well, in this example, let's say bottom left. External force is trying to bend me to the right. So my agonist needs to be muscles that are trying to bend me to the left. This new stuff just says, who are those muscles? Left sterno, left erector. If I'm using an agonistic group that's trying to bend me to the left and I observe motion to the left, that has to be concentric. And if I'm using muscles that are trying to bend me to the left and I observe motion to the right, it has to be eccentric. Contraction is solved for. And I think that's why so many professionals have a tough time with concentric and eccentric, because it's not taught to you the way it should be taught to you. You identify the agonist. Who are those muscles in the agonist? Awesome. And then once you know who you're pulling with, then you utilize motion to prove the contraction. I got 2 minutes. I'm going to take them all. Guys, it's no different than if you're doing curls. You know this. If you're doing curls, you're working your biceps, then you brachialis, and you break your radialis, your flexors. And you know that when you lower it down and you have extension, you're not working different muscles. You're working the same muscles. So how can the same muscles be responsible for both flexion and extension? Different contractions. We need to be able to communicate without guessing where's the concentric, where's the eccentric, because that is a very useful tool for you guys to use when you get out in the real world or you go to graduate school. Okay? And that's why I teach things the way I teach it, is so that we can see contraction easily.